Before we move on to the tape bandage, we have to prepare the tape. What we will do is we pre-cut the kinesiology tape and rounded all the sided to ensure it does not pick up dirt and to ensure the tape is adhesive properly.
For general shoulder injuries, the requirement is only 2 strips of kinesiology tape. And before we begin the first strip, the patient arm have to reach across the chest to slightly stretch the back of the shoulder. Then preparing the tape and creating around 2-inch anchor and place it about 4-inch below the shoulder joint in the outside of the arm. Then apply a light stretch on the tape while adhering it along the back of the shoulder, curving slightly up towards the top of the shoulder. Next, prepare the second stripe, placing it to the first anchor. The patient arm have to reach the arm behind their palm facing forward. Then, apply a light stretch on the tape with one hand while curving slightly up towards the shoulder and finish it with a gentle rub to improve adhesive. For this application, position the elbow at 90-degree angle. For the first strip, tear backer paper 2 inches from end to create your first anchor. Place the anchor on side of the triceps muscles with no stretch. Peel backer paper from middle segment of the strip. Apply tape with moderate stretch down to the side of the arm and curving under the elbow joint. Lay down the second anchor on the back of the forearm with no stretch. Create an anchor on one end of the second strip. Repeat the first same technique as the first strip on the other side of the arm, crossing over the first strip under the elbow joint. Lay down the first anchor with no stretch. Smooth over the full application to ensure tape is completely applied to the skin. For wrist swelling, we need 2 strips. For this application, firstly, bend the wrist slightly to place a stretch on top of the wrist. Then tear the back of the paper to create an anchor. Then place the anchor on top of the wrist with no stretch. Peel the back of the paper from the middle segment of the strip and apply it with light stretch along the forearm. Secondly, is tear the middle of the back tape and peel to expose the middle segment of adhesive, and then apply moderate stretch to adhere it across the first strip at the wrist. And lastly, smooth over the full application to ensure tape is completely applied to the skin. For knee swelling injuries, we need 3 tapes. First, short tape, we have to tear the backing paper and place it directly below the knee joint. We are going to place the tape with 80% stretch first, then lay it down all the way to the very end of the tape with 0 stretch. Next, the tape will be laid on the quadricep muscle upon the thigh muscle and stretch it all the way to the end of the edge of the kneecap. Then, the last tape will handle it like the previous piece, but the opposite side of the thigh and tape as we go around the front knee while applying little pressure. And before we do this, make sure we remove any lotion or clothing when taping and make sure the tape is secure at its place.
To apply a knee roll bandage, begin by wrapping the bandage around the leg at mid-calf level, circling the leg a few times to ensure it in place. Move the bandage diagonally up behind the knee, then wrap it around the leg above the knee joint. Continue wrapping diagonally behind the knee in a figure 8 pattern. Repeat this motion several times to provide stability and support. Once complete, finish by wrapping the bandage straight around the leg above the knee several times for added security. Secure the bandage using elastic clips to ensure it stays in place. To apply a hand roll bandage, start by placing the bandage on the inside of the wrist just below the thumb. Wrap it around the wrist twice to secure it. Bring the bandage diagonally across the back of the hand to the base of the little finger. Wrap it straight across under the fingers, then back diagonally across the back of the hand to the wrist. Repeat this diagonal figure eight pattern, overlapping each layer slightly as you go. Make sure to leave the fingertips visible to check circulation. Once the hand is fully covered, wrap the bandage around the wrist a couple of times and secure the end of the bandage.
First of all, place the center of the over-compress to cover up the wound. Next, carry the ends around the opposite side of the head and cross them over. Bring them back to the starting point and tie them over. First of all, put the foot at a 90-degree angle perpendicular to the tibia to create a compression foot bandage. Next, start by wrapping the bandage around the front of the foot, then work its way up towards the ankle from outside to the inside. Wrap around the ankle several times before coming back down to the middle of the foot. Reapply the bandage under the foot and up around the ankle, and then fasten it with the provided clip. First of all, place the folded base vertically over one arm with the pointed side directly under the elbow of the injured arm. Next, the lower end of the base at the side of the neck, use a square knot to tie. Make several twists to tie a knot and hide it.